Welcome again to the Nourish and Flourish podcast series, where we will bring in different health and lifestyle related topics to you in simple and actionable way. I'm Raja Mitra, a technologist from Silicon Valley, California. A quick disclaimer for medical legal reasons. Any of my notes, comments, suggestions should not be considered as a medical advice or consultation in any form. Also, as of now, none of my quotes or references are commercially funded. Today's topic is an overview of diabetes, testing, and medication. Do you know that combination therapy of diabetes evolved over the years? And now American Diabetes Association 2025 standard of care and EDIT study are mostly aligned. While you may be still undergoing treatments based on old guidelines. Do you know that GLP-1 or GIP agonists like Mounjaro, Ozempic are significantly effective in diabetes control along with weight loss and heart health? We will be covering this today. As usual, before we start, here are a few statistics. More than 1 in 10 adults around the world has diabetes. And if you count prediabetes, this is about 1 in 4. That's kind of an epidemic proportion. Diabetes is the 8th leading cause of death and number 1 cause of kidney failure, lower limb amputations, and adult blindness. Most of the diabetes cases, however, are due to poor lifestyle and dietary choices and can be managed well or, in some cases, partially or fully reversible with proper medication, diet, and lifestyle. What is diabetes? Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. The component of food that produces energy are carbohydrate, protein, fat, and after biochemical cycles, some leads to glucose production. The usage of glucose or sugar in the body is controlled by the important hormone called insulin. Most cases of diabetes are due to deficiency of insulin or insensitivity to insulin. Insulin is produced by the beta cells of an organ called pancreas, which sits in the abdominal cavity behind the stomach. There are 3 main types of diabetes: gestational diabetes, diabetes 1, and diabetes 2. Gestational diabetes develops in some pregnant women and usually goes away after pregnancy. With type 1 diabetes, pancreas makes 0 or very little insulin. This is mostly a result of autoimmune reaction where body's immune system attacks insulin producing beta cells in pancreas. People with type 1 diabetes would need insulin every day in injectable format. Type 2 diabetes is most common, about 90 to 95% of all diabetes cases. Here the body doesn't use insulin well and can't keep blood sugar at normal levels. In most cases, people would have developed insulin resistance or hyperinsulinemia. Type 2 diabetes develops over many years. In this forum, we will mostly talk about type 2 diabetes because of its relative high prevalence. Then we have prediabetes, which is a condition with elevated blood glucose levels but not yet at diabetes levels. The HbA1C numbers lies between 5.8 to 6.5. People with prediabetes are at high risk of developing diabetes, with up to 50% progressing to diabetes within the 5 years. So, having discussed about diabetes, what other kind of diseases are we looking at? People with diabetes tend to have higher chances of heart diseases, hypertension, and stroke over their lifetime. If not managed well, it can result in lethargy, drowsiness, and slow wound healing. If diabetes is not managed well over a period of time, it can result in kidney failure, blindness, and even lower limb amputation. So, we talked about diabetes and insulin. Question is what kind of testing we should be doing? In order of importance, it is HbA1C and glucose monitoring in the form of CGM or BGM first. HbA1C is a measurement of average glucose accumulation over a period of couple of months. And it's the single most important low-cost test. The goal is to keep the number below 5.7. Continuous glucose monitoring or CGM are kind of wearable devices that periodically measures the blood glucose over a period of about 2 weeks. In market, these are branded as Dexcom, Libre, etc. One can also do spot checks at home with glucose testing kits called blood glucose monitoring kit or BGM kits, or even at a diagnostic center. Then there is insulin test, which directly measures the level of insulin in the blood. We will have a follow-up session podcast on this called 202 diabetes testing. Given that a person is diabetic or even pre-diabetic, let's talk about medication. The most common frontline type of drugs are metformin, SGLT2 inhibitors, sulfonylureas, DDP4 inhibitors, alpha glucosidase inhibitors, etc. These drugs have relative benefits and risks. Hypoglycemia and diabetic ketoacidosis are common complications of diabetes treatment. Your physician may be using one or multiple of this, but it will be worthwhile to reevaluate the prescription in terms of effectiveness, efficiency, and safety. Then there are semaglutide drugs like Ozempic, which is branded as Wegovy for weight loss treatment, or Mounjaro. These have gained popularity because of weight loss management. The modern guidelines rely on a combination therapy where these GLP-1 GIP agonists class of drugs play a significant role and sometimes much more effective than the traditional frontline drugs. We'll have a follow-up session podcast on this called 203 Diabetes Medication. There are also some natural herbal supplements like berberine, cinnamon, etc. that also helps, but ensure to research well and consult physicians before taking these along with other medications. For diabetes cases that are uncontrolled with use of standard line of medication, there are direct insulin delivery treatments or even pancreas and islet transplantation surgical options. These are topics that can be discussed in separate sessions. So we come to the last section where we discuss what to do and not do. Like I mentioned for cardiovascular and other chronic diseases, the first principle is what you can measure, you can control. So at least make sure you measure HbA1c regularly and from early ages. It makes sense to detect any signs of prediabetes early and start taking appropriate actions. You may use a continuous glucose monitoring system occasionally or regularly to understand the impact of your diet and then take corrective action. Like heart diseases, the priority to timely control diabetes should be medication first, then diet, then sleep and exercise. We already talked about medication choices. do ask your physician to consider GLP-1 GIP agonists and SGLT2 inhibitors in your treatment regimen. These are excellent class of drugs that have compound benefits beyond diabetes treatment. In terms of diet, keep it simple. Eat less frequently, in less quantity, with minimal carbohydrate and processed food. In recent times, time-restricted diet, what you hear as intermittent fasting, is gaining popularity. Then, good quality 6+ hours of daily sleep in a noise and light-free ambience is very important. Incorporate simple exercises like walking after every meals. Then gradually build up on resistance training and aerobic endurance. Needless to say, completely drop smoking and alcohol. This concludes today's session. We will have more podcasts like this to educate ourselves, nourish, and flourish. Stay tuned. If you like this podcast, would appreciate you clicking the like button and subscribe to the channel.